I'll vacate my position.
Thank you. Hi, everybody. Thank you for having me here today, and thank you for your excellent research. It's really exciting to hear what you're doing. I come from Environmental Working Group, where I'm a senior analyst. I have no conflict of interest to declare, and I have no slides. So we're a nonprofit advocacy organization, and our job really is to evaluate the scientific information that's available and look for opportunities for policy intervention, and also look for opportunities for public education. I think it's clear from the presentations and from the discussion we've had that we aren't going to be able to identify a solution to the ongoing crisis of obesity and obesogens so easily, especially in 5 minutes of presenting. But I want to say that the good news is that there's ample data to take action and reduce public exposures to all of the chemical and endocrine disruptors that have been presented today as case studies. These are data-rich chemicals, in my opinion, not necessarily for their role in the obesity crisis, but because of all the other hormone disruption and toxicological endpoints that they have posed. And we know from POPs, organochlorine pesticides, BPA, phthalates, and the perfluorochemicals and phenols, these are chemicals ripe for intervention. We have biomonitoring data. We can, in many cases, identify the populations that are at risk. We can name sources of exposure in consumer products, industrial chemical releases. And I would say for these chemicals, particularly because they're among the better studied endocrine disruptors, we also know that people are being harmed by these exposures. And so my role as an advocate and as someone who tries to influence policy is to learn from the data, but also identify those intervenable sources of human exposure to chemicals that are known to be harmful. A major challenge we face that has been discussed is that the U.S. is woefully behind in our screening of all the chemicals on the market and our ability to prioritize and to figure out the hazards posed by chemicals with far less data. And that's largely due to the Toxic Substances Control Act, which was passed in 1976 and grandfathered in 62,000 chemicals that were already on the market and met this presumption that they posed no unreasonable risk to human health or the environment. And we obviously see that that's not a safe assumption to make about the chemicals that were in widespread use at that point. EPA faces an incredible burden in taking action on those chemicals and has only been able to ban PCBs under its authority with TSCA. We know that also there's an incredible burden in screening new chemicals, and EPA's new chemical program has 90 days to evaluate chemical applications. About half of chemicals have very little or no data about physical chemical properties and health endpoints. There's actually kind of a catch-22 where companies have little incentive to develop that data because then it has to be disclosed for the new chemical submission process. EPA has approved 40,000 new chemicals since TSCA was enacted, and the names and basic identities of these chemicals are in many cases trade secrets, not disclosed even within EPA, let alone to the greater research world or to the public. So we also see this rapid turnover in the chemical market, and when we take too long, chemical screening and prioritizations, the efforts that take too long, we'll see that 20% of the high-volume chemicals actually aren't even produced in significant volumes in the next reporting cycle. So any system that a major policy need is a way to screen and rapidly address chemicals during that period of time they're on the market, knowing that there will be always this influx of new chemicals. Barbara mentioned earlier that food additives are at least tested thoroughly in animals before they're put into food, which is only partially correct because under the FDA GRAS program, a company can self-certify that an additive that they want to produce is GRAS, and they don't even have to tell the agency that they've added this chemical to their list of secret GRAS chemicals. So we see major gaps also with the chemicals added directly to food. Yet, despite these problems, I continue to believe that environmental interventions hold great promise in averting crises like obesity and other metabolic disorders. And that's because rather than shifting individual behavior practices and requiring these lifelong changes in behavior, we can do something that may be permanent, may be effective across the population. And we've seen in so many cases that environmental interventions and changing consumer products is a very cost-effective way of reducing our exposure to hormone disruptors. So we know that the general public is incredibly concerned about their health, their children's health, the role of environmental chemicals in their health, and in the absence of federal legislation and changes to chemical policy, we see really quick changes in the marketplace. Some incredibly positive, like the removal of BPA in the liner of baby bottle, baby formula containers. You know, liquid and formula was commonly sold in cans that were lined with BPA, with low levels of BPA, in a product that could be 100% of a child's diet for the first 6 to maybe 12 months of their life. And so that's a great example of quick change in the market that really can dramatically reduce exposures during a period of intense concern. And we see ban on phthalates in some kids' products and the growth of organic and natural foods as positive trends. We've also learned hard lessons about chemical substitution, the replacement of bisphenol A with bisphenol S in thermal paper, receipt paper, the replacement of neurotoxic insecticides like organophosphates with bee-killing and pollinator-killing neonicotinoid insecticides, and even something you might not be aware of is the natural food product interest from savvy consumers in avoiding high fructose corn syrup led to the use of organic brown rice syrup as a sweetener in a lot of processed foods, and now we're realizing that rice, and especially brown rice, is loaded with arsenic. So this way that people buying supposedly more healthy processed food, we're actually buying food with arsenic in it. And I don't know nutritionally that there's any benefit to eating brown rice syrup as opposed to high fructose corn syrup, but maybe someone here knows. So as a parent with 2 small children, and children who've taken remarkably different growth trajectories in their early years, I am reminded every day that no amount of reading the scientific literature can actually protect the health of my own family, and that it's still really important to try. So that's where I'm coming from in a policy setting. And as scientists, I'd urge you to join me in that struggle to identify the most obvious problems concerning consumer exposures, problems for kids and the safety of our food supply, and trying to fix that. In my organization, Environmental Working Group has done things like product testing to identify the widespread use of BPA on thermal paper and in canned foods, just kind of as a way of raising consumer awareness and raising awareness maybe in the scientific world. We've developed several apps for consumers that are incredibly popular. We have a app, an online database of body care products with about 80,000 cosmetics and soaps and lotions to highlight the widespread use of endocrine disrupting chemicals. One chemical that was mentioned previously is benzophenone 3 or oxybenzone, which is in about 5 to 6% in sunscreens, in almost every sunscreen sold in the United States, thinking about an exposure regime where somebody would put that all over their body several times a day and leave it on. So we also have a food app that has 80,000 food products and barcode scanning. We rolled it out in the fall, and we have 80,000 downloads already and lots of scans. We help people identify trans fats, artificial sweeteners, the potential for BPA in canned food, high mercury fish, as well as giving a nutritional assessment that takes into account the degree of processing, saturated fat, and other known nutritional problems or indexes. And we've written countless public comment letters, lobbied on behalf of TSCA reform, GRAS reform for food additives, and ongoing support for research and biomonitoring for toxic chemicals. So I'd like to encourage you guys to join us in this effort. I think everyone, we have wonderful leadership at NIHS and other agencies right now, but everyone could continue to move forward in translating their research for the public, drawing conclusions about the attributable risk. I think, you know, the stat about the role of soda in the obesity crisis is incredibly helpful for the public, and it actually can be incredibly motivating. And whether or not everybody changes their patterns, you know, that kind of clear information that pinpoints problems and helps people prioritize in a non-judgmental way, of course, is really helpful. And, you know, I think, as we've seen with vaccine safety, it's not necessarily something can be completely safe and completely well studied, and still, you know, the media and the public debate frames it as uncertainty and, you know, lack of conclusion. And I think that we have to extend ourselves not only to beyond our research, but to defend the process of safety assessment, discussing uncertainty with our own research, but the things that we know and the things that have been studied and have been found to be not safe or not healthy, or the things that haven't been studied, the idea that probiotics there's very little safety data or long-term study about their efficacy. And I think that these are all ways that research scientists can contribute in our effort to make better policy and make people healthy. Thank you.